Yeah. Okay. Well, welcome everyone. Thank you for coming. Thank you for being here. I'm going to give you a quick session overview of what to expect. Okay. So I'm going to briefly introduce our speakers, and then I'll give you a quick background on our role. I'm Camille Hoisington, Director of Ecosystem Development with Traverse Connect. I'll give you a brief overview on our role as Traverse Connect with this project. And then I'll hand it over to our speakers to dive deeper into what each of their roles are in this project as well. So a little bit of background on this project as a whole. Earlier this year, the state of Michigan announced a Advanced Aerial Mobility Activation Fund. And that fund was put together in partnership with MDOT, so Michigan Department of Transportation, the Office of Future Mobility and Electrification at the Michigan Economic Development Corporation. So those two entities came together to create what's called the Advanced Aerial Mobility Activation Fund. It's the first time they're doing this, and it launched earlier this year. Over $6 million in funding was awarded to 4 separate projects. One of those projects was here in Traverse City. Actually, there's a second one where there's some dollars going to TBC, to Cherry Capital Airport. Our role as Traverse Connect, we sort of formed the grant team, pulled together all of the partners that would be involved in these projects. Our role is we're calling ourselves the regional implementation partner. And really what that means is that we're responsible for coordinating the many players and many partners involved in this project. Our role is to establish that stakeholder group, help the group form their use cases, find test sites, equipment sites, and then also our role will be to provide communication to the public and be sort of that public-facing interface or first port of call if someone is interested in learning more. A little bit of background, because I keep saying this project, but there's actually several projects that we've been awarded funding for. The one that we are here to talk about today is our Rural Healthcare Delivery and Hospital System Optimization Project. Basically, what this will be, in sort of simple terms, is the use of drones, which, you know, we've been using this term, advanced aerial mobility. Drones is sort of the obvious one. So using drones for delivering medical supplies and cargo between hospital systems, in this case, Munson Healthcare. And we'll be testing, deploying, proving the feasibility of moving medical cargo between Munson facilities, with the idea that this can be eventually optimize efficiency for the movement of critical parts and goods within medical supply chains. Ultimately, that will improve, hopefully, patient outcomes and improve medical supply chains and just sort of reinforce the system. So that is our role. We will have time for Q&A at the end of this. We'll have a lot of time for Q&A. So we're going to go sort of down the table, and then towards the end, we'll have 20 to 30 minutes for Q&A from all of you. With us today, we have Tracy Cleveland. He is Vice President for Supply Chain at Munson Healthcare. We also have Joel Davidson, who is Senior Manager for Enterprise Project Management at DroneUp. And then we have Ross Davis, who is Design and Systems Engineer at bluflite. And then we have Allison Arnold, who is Executive Director for the Rural Health Equity Institute at Central Michigan University. She's located right here in this building. So without further ado, I'm not starting with you, Tracy. We're going to start with Ross and bluflite. So why don't you tell us about the technology implementation and the specifics?
Great. As mentioned, I'm a design and systems engineer from bluflite. I'd like to talk a little bit about the technology and what bluflite's working on in the healthcare space as well. This project. So our job is to bring a safe and reliable aircraft for DroneUp to operate. You have a picture over here of the M46, which is a delivery aircraft. It has eight, okay, it's an octocopter, so that means it has 8 motors, propellers, 2 on each arm, which adds a little bit of redundancy. Each of those arms tilt independently of each other, and what that gives us is advanced maneuverability and a higher cruise speed, which means we can fly farther than comparable aircraft. So we're great in the wind, and the package goes inside of the drone, so it is discreet and safe from the weather. And the drone is built in to have multiple or a variety of fail-safes and safety protocols for autonomous flight. If you were to lose connection per se or cross a GPS boundary, the drone can deal with that itself. And in the case that our operator needs to take over, the pilot is always on the sticks ready to go. And there is a camera on board for them to have situational awareness. And that feed is streamed directly to their ground control station. But there is no recording taking place during flight. I think the biggest awesome part of this slide is that a banner in the top left corner. The aircraft is fully assembled in Brighton, Michigan, which is just north of Ann Arbor. So that's where I'm based. So I can definitely say that everyone on our team is very excited to be a part of this program and work in our home state. And we're very familiar working with the state of Michigan, the Michigan Economic Development Corporation, City of Detroit. We've worked with the bases in Alpena and Grayling, and now finally Traverse City. So that's really exciting. You want to go to the next slide, please? This is something we're working on the side, or another project that we're pursuing with the Department of Transportation. But essentially, the Department of Transportation has identified that in accident sites, there's a critical need for blood on site right when it happens. So what we're hoping to do is to be able to deliver blood as soon as that call is made and the accident is reported. I think what this highlights is the great things that can come from medical drone delivery and why it's important to take these opportunities to prove out the system and find the pain points and see where we can, serve the community with this. So thank you for that. It's a great opportunity to talk about.
Thank you, Rob. Joel, we'll stay in the lane of the
Good.
explanations and move to you next.
All right. I'm Joel Davidson. I'm not gonna stand. Ross, you're already taller than me. It'll make me, I look short. So, I'm from DroneUp. We specialize in delivery. We've been doing it for quite a few years now. We do last mile delivery for Walmart in quite a few states, as well as quite a few locations for Walmart. And then on my side of the delivery spectrum, I do most of the special projects and other use cases. So especially the medical side. We've done multiple kind of proof of concepts of medical delivery for other locations. The one was with the Carillion Clinic in Roanoke, Virginia, where we did kind of 2 phases with them. We did an initial phase where we just kind of discovered, does drone delivery work in the hospital infrastructure? And then a second phase where we really optimize the ability to deliver more goods and more weight really across the campus, as well as using automation with like our DBX, which is a drone. It's a delivery box. Drone can land on top of it. The box goes into the delivery box from the drone goes into the DBX, and then it sits in a environmental controlled area until a person is able to walk up, put a QR code, and then grab the box and walk away. And then that also works in reverse, where a person can walk up, put a box into the DBX, a drone would pick it up, and then deliver that payload somewhere else. We also have experience doing some long distance flights on the eastern shore of Virginia, where we have delivered medicine and lab samples to and from Tangier Island, which is a small island in the middle of the Chesapeake Bay. It's about 17 miles away. Very hard to get to. The only way to get to it is either by boat or by plane. And we have proven that drone delivery to and from that island can save days of time when it comes to getting medical supplies. So we're very excited to kind of bring those 2 use cases here and explore both the inter-campus delivery as well as in the future the rural.
So Tracy, can you set the stage for us a little bit, just to go back, tell us about the challenges maybe that as a supply chain director that you're facing with Munson, and how this conversation came about, how you saw this being a big opportunity for Munson healthcare.
Absolutely. Thank you. The slide really helps to illustrate the problem statement. Our service area for Munson Healthcare is across 29 counties and serves a population of about 619,000 people. It is hard to get there most of the time. And so we spend a tremendous amount of time on the highway, going between facilities to support those different healthcare initiatives, whether they're acute care hospitals or clinics. We need to visit each one of those locations on a routine basis. It adds up to about 90,000 miles of travel per year. About a year ago, at the Economic Summit, Justine Johnson was present, and I was able to catch her in between sessions. Justine is with the Office of Teachers and I can't get it right, mobility and electrification. And I asked her if there was anything on the horizon that would bring drones to Northern Michigan. And she said, well, as a matter of fact, we just started talking about it. Let me take your card and we'll call you. And I don't know, 8 or 9 weeks went by and I got a call, and we have been in the formation discussions about bringing supply chain drone delivery to Northern Michigan ever since. So it's very exciting to think about how can this technology improve access for those 619,000 people across Northern Michigan. Not everyone can come to Traverse City for their health care. And so our strategy as a health system is to maintain hospitals in local communities and then figure out the logistics of testing acute care, more advanced or more difficult patients, where exactly should they get their care, with the thought that people are best suited getting their care as close to home as possible. So today, we spent some time driving around just the greater Traverse City area to see what would be a test case that we could do providing with the resources provided by this grant. And so we drove up to Copper Ridge Surgery Center, and I didn't know you can actually see the comments from Copper Ridge Surgery Center. And so all of the restrictions about line of sight with drones in the beginning part of this exercise, we can meet those requirements and still be able to prove and improve the care to patients. We had an opportunity to visit with our laboratory this morning, and she started ideating, and right now we batch samples from Copper Ridge to the medical center to come into the laboratory for testing. And she said, if there's a patient where we can save 4 to 6 hours from the time that sample leaves Copper Ridge to the time that it gets to the medical center, because we're not waiting for a driver to come and get it, that improves and accelerates the care for that patient immediately. So we're talking about a 2-mile distance that can improve the care for patients. I'm going to say today, but as soon as we can prove that it works. So the rural nature of our service area is the challenge. We're taking a crawl, walk, run approach. And so we need to do what we can with the resources that we have now, and then hopefully expand so that we can support the entire region. And even we talked about going downstate and taking samples before every 4 somewhere downstate. At some point in the future, I think the technology can support that.
Can you talk a little bit more, Tracy, about you said 90,000 miles per year is spent on the road between Munson and healthcare. How do you see in the long term this will benefit Munson in terms of, you know, taking people's precious time off of the road and putting it to more critical areas?
So we have a challenge of retaining and recruiting enough people to do the work within Munson Healthcare. And so if we can take someone whose time is currently dedicated to driving and fit them into a different slot within the system where they're working at a higher level or an area that we are having trouble recruiting for, that's a win-win. So the human resource component of being able to put people where they can do the best work with other people and allow the technology and to take care of the transportation. So that's number one.
And just before we move on to Allison, could you talk a little bit more about the difference between phase 1 and phase 2 of this project and the distance and scale?
I can a little bit, I might rely on Joel for the detail. Phase 1, we are limited by many rules, good rules about protecting the safety of people in the community. So where the population is, where the roads are, what you can see, all of that governs what we can do when we start. And so part of the conversation was getting the drone from one point to another point and proving that that's a reliable, repeatable activity. And it really doesn't matter what's in the payload. We talked about water bottles today. We could move water bottles from one spot to another spot, back and forth, and prove that the drone can do that. If we have the opportunity to work with the FAA and other regulatory agencies so that we're not interfering with airspace, and then we have the ability to expand our scope and scale from a distance perspective and how the drone travels from one spot to another. So we're going to be looking for, in some cases, waivers, in other cases, another level of certification by the drone operator, what they can do, given their certification. So we'll start small, close to the campus. Again, visible line of sight needs to be maintained on the drone. And that can be at the receiving side or the sending side, but between the two sides, we have to be able to see it the whole time it's in there. And then later, the technology would be able to see it. We'd be able to track it with GPS or some other methodology if it were traveling 5 miles, 8 miles. Right. Okay.
Thank you. So Allison, you're our research partner. Central Michigan University is our research partner in all of this, and your work focuses on rural health equity, and you'll be doing some data and impact metrics work for us. Can you expand on that for us?
Sure thing. So when we had the first opportunity to learn about this potential pilot that was going to happen, and talk about the equity focus on health equity that our health institute is a big part of our work. It just seemed to be a wonderful space to think about rurality and the issues that rural communities face, and think about how an innovative way of reaching and providing access to rural residents could really help us rethink some of our challenges, as you mentioned. And so we just jumped right in and said, we'd love to be a part of this learning process. That will be our role. That's what our institute is really what we're focused on doing, is just teaming up in local communities, working together with leaders in those communities who are focused on projects and solving problems and creating, kind of as local as possible kinds of solutions to their challenges. So we will be following the work from the standpoint of providing opportunities for the team to reflect on, how that project, you talked about crawl, walk, run, our learnings throughout this pilot project, and including, what are the maybe anticipated, unanticipated kind of questions that come up. And so that is really kind of our job as just a reflective partner in this particular pilot. A lot of times our institute is involved with matching up resources. Then, so I will go back to our university and tap into some of the resources that might be relevant and helpful to local communities. We have a drone lab at CMU that works very closely with NMC's drone program here in northern Michigan. They are very much a listening ear on this project as well. If we need to pull them in to support us with some research, some tracking down some questions that may arise. So that's a little bit of our role, but I did put a little one more piece if you want to advance that. I will say other projects that we're involved with are telehealth expansion, very important to us, telemedicine, telehealth, recognizing that, there's a challenge in rural communities with access to health and especially behavioral health services here in the north. And so while we love all the vital reasons that we live here and we have such wonderful assets, we do have some vulnerabilities that you mentioned, Tracy. Our workforce, we have a substantial workforce shortage in health professions, everything from physicians to social workers to nurses to almost the whole gamut. And quite honestly, our academic programs, whether it's CMU or all the others that are working so diligently in this space, we can't turn out a workforce as fast as the need here. So it really is, how do we think in an innovative way about the way we provide care? And could we provide it in ways that free up some of our expert, talented staff that are already existing and supporting the system and supporting care? Can we provide that more timely turnaround to avoid delays in care? We know that here in rural Michigan, that just lack of transportation in some cases, or challenges in transportation for rural residents, really delays their care. And then that can result in more acute kinds of concerns over time. So what can we do, and how can we focus on initially it will probably be some anecdotal kind of information like Tracy shared, just the revelation that someone working right in the process could see how this would exponentially improve someone's care that they're working with. But we'll be looking for those kinds of stories and trying to understand them, as well as, all stories. If there's stories that we need to learn from, we will be trying to capture those as well. So we think these opportunities to innovate could not only improve the care, the speed of care and access to care, but also swifter positioning of important supplies and resources to outlying rural communities and what that might mean to the delivery of care. So it's a little bit of our relationship to this, what we hope to unearth as far as learnings, and hopefully turn that back then to the team to think about, as the project expands.
Allison. I did want to just give a brief overview of our timeline and when we're planning to implement this project. We're right at the beginning of this project right now. So we are hoping to, within the next few months, be able to launch phase 1, which will be the shorter distances that we'll be flying drones through. It will be largely weather dependent because you can't fly drones under certain temperatures, certain weather conditions. So likely phase 1 will hopefully start this fall, winter, but it'll complete within spring, summer of next year. And then phase 2 will be summer of next year. And phase 2 being those longer distances where drones are bringing medical cargo from point A to point B. And this is our first community info session, but we plan to host several of these throughout the duration of the entire pilot. So there'll be more opportunities to engage, and there'll be more opportunities for us to tell you how it's going and to tell the story as it's happening. But again, the purpose of these sessions is for the community to come and hear and listen, hear about what's happening and to ask questions, because when there is new technology being put in place, there's always questions. So we wanted to open up the floor and see what questions you all have.
I have a question about the drones. How big are they and what's the payload like the weight?
Yeah, so the drone is about a meter by a meter, so 3 feet by 3 feet. And the payload capacity is 10 pounds. So we can fly around 13 miles right now with 10 pounds. As you bring that weight down, obviously the range is increased. And when we talk about phase two, that's a version of this aircraft where wings are installed, the colors still fully forward 90 degrees, so it flies like a regular aircraft.
The entire project is 4 feet. There's a lot of time built in there for things like compliance regulation. Because our technology company needs to get around to this FAA regulations. Phil, you're the expert on that. Do you want to talk a bit more about that?
Sure. Yeah, so the initial flights, like Tracy alluded to, they can happen fairly quickly because they would happen kind of under Part 107, which is line of sight operations. As long as we're maintaining line of sight of the drone and then in compliance with Part 107, it can be done. In order to fly what we like to say beyond line of sight, that requires at least a waiver to Part 107 just to fly. To do delivery and delivery even for compensation under beyond line of sight, that requires a much larger, I guess, effort, which is called the Part 135 at this time. The FAA is in the process of kind of releasing or talking about a Part 108 rule set, but we don't know if that will be even released or ready in the timeline of this project. So really, it would be seeking some waivers to Part 107, and that can take a decent amount of time because you have to prove a lot of the safety case, the routes that you're going to fly, a lot of the things that you need to make sure the FAA is comfortable with even allowing you to go beyond that site. So that process can take some time. You're kind of at the mercy of the FAA and how busy they are.
If there was to be some sort of, drone crash or something where it does kind of go down wherever that is, in the city, in the woods, et cetera, what is the policy or the procedure for like recovering like biohazardous materials that though they may be carried before there's like risk of like access to the public or something like that?
Yeah, so I think the key there is we wouldn't want to transport anything, and we talked about this, that is truly biohazard to the public, right? We wouldn't be transporting a blood that if someone came in contact with, they would get some kind of contagion or anything like that. It would be, while nobody wants to touch clean blood, it would be, like cleaner, not so much a biohazard. So that would be the number one thing to not worry about. Number two is the drone will have a parachute system on it. So if there is some kind of emergency in the air, the drone won't necessarily hit the ground at a high speed and come apart in a big, thing. It's going to float down on its parachute, which is a nice thing and much easier to gather everything up if that was the worst case scenario. But we don't anticipate that. Sure, that's right.
And one of the things that happened before that, right? So if you were to exit a geofence, it can return to home by itself. The pilot can take over and find a safe landing location. They will be worrying on battery, things like that. So a lot of things that help you to run forward.
Sure. Sure. And who would be the one to recover? Would that be like Munson would be out recovering it, or?
It would be our team, the pilot team that could recover.
Not assuming that would happen, just probably a question I'd imagine people would ask.
And to your point, the initial route planning is going to be kind of over very sparsely populated areas. We don't want to, we don't see the need to fly over houses or people if we can pick a route that allows us to just kind of fly over parks or unpopulated areas. That's obviously the better route anyways. So that's the case. Even the great thing about this area is if we decide to go north, there's a nice big body of water to fly over, which if you go down in the water, unfortunately, you probably lost it, but it is still much safer than not. The chances of hitting something in the water are very low.
Would also add that the purpose of this grant and its first initial launch of it from MDOT and MEDC is to create a centralized pipeline of projects that can accelerate readiness and growth for advanced aerial mobility. What that means is this is trying to prove the concept that it's feasible, viable, and reliable, and can actually be applied then in the real world. So it's definitely a test phase.
Yes, of course.
You mentioned weather. What kind of, weather in this
Sure.
area? What kinds of weather can it fly in rain? How high the winds have to be before you would call it off?
Yeah, so we can fly in heavy winds, so it's up to 30 miles an hour. That's the gusts. And we do offer some rain resistance and to fly in, right? So we spec light rain as specified by the airport, and that goes to like 2.5 millimeters an hour. And then you really want to imagine that you're not seeing splashes on the ground when the droplets hit, and they don't completely wet surfaces, but there is a little bit of precipitation in the air. The main part is not necessarily the internals of the drone, right? You can notice that we have a body that covers all the electronics. It's really the motors. And so we've identified that that level of rain is not a risk for the motors to shut off, right? And that's what we're going to bring in phase 2 is a motor that's completely IP rated and sealed against rain. And then we can bring that level of weather resistance up and have maybe performance targets that say, okay, we're not going to cancel a flight to rain this many times, right? So that we can really start to measure the success of the program.
I think the key things with weather too, that, even if it is, you have the capability to fly in a downpour of rain, it may not be the safest thing to do because you really can't see through that rain, right? If it's a downpour of rain or even snow or sleet, visibility does become an issue, and aircraft don't fly when they can't see very far. They have certain minimums that they can't take off from or land in, and we also would fall under those regulations as well. So while we attempt and want to be able to fly in higher winds and higher rain, at some point there's always going to be a stop to it's just too the rain is too much because we can't see, the drone can't fly. And then temperature wise, as long as really, the batteries are better when it's warmer outside than colder. So there is battery performance consideration, but they can operate in cold weather. It's just more precautions that we have to take to make sure that they're fine. And then icing and visible moisture that can turn to ice is something that we would not operate in, only because most drones of this size do not have a de-ice or an anti-ice capability, which is too heavy to put onto the drone.
What's the overall distance within the test to go early on pilot? How far you can test? Where's the limit of the testing distance?
So I think the initial couple sites that we've looked at are not very far away. They're 1 mile to 2 miles, kind of as the bird flies or the crow flies. The drone is capable of going further. I think right now, would you say 14 or 15 miles?
Yeah, that's the full trip. So we can see up to 5 or 6 miles out.
Right. So the phase 2 would be longer, beyond line of sight anyways, because you can't, a human can't see 5 or 6 miles. And then with the wings and the at scale potential, it's somewhere in the 60 mile range.
There's no more questions. Thank you all for coming. Thank you for listening and for being here. I know we do have some time set up if there's any or anyone wants to do interviews. Hold some time and please check. Thank you, everyone.
Your time.